And you're listening to Anne and Sheila. It's the Health Show on MarlowFM, and I'm delighted to welcome to the programme our first guest this morning, Dr Duncan Carmichael. Dr Carmichael, could you introduce yourself and let the listeners know who you are, where you are as well?
Morning, Anne. Morning, Sheila. Morning, listeners. Yes, I'm Duncan Carmichael. I used to be a GP down in Poole, Bournemouth. I've then gone on to other things. And one of our special interests is gene testing and its relevance today. And I'm phoning all the way from Cape Town.
Fantastic.
That's Cape.
Yeah. Thank you so much for sparing the time this morning and joining us on the show. So just to start off, direct-to-consumer genetic testing has kind of hit the headlines. It's been in the media. It's been advertised on TV even. So, many of us are aware of the availability of this kind of personalised testing. And I guess 23andMe is the one that's, hit the headlines and people know about more. But I'm interested to know from your point of view as a professional medic, how you see its usefulness to, the average person. Where do you see the real benefit in using this type of testing?
Yeah. And, we see gene testing as being very useful, but it's in its early stages, and certainly direct to consumer has never been a good idea within anything inside medicine. So you can't do an HIV blood test and sort of get your results direct from the lab as a consumer. It's a terrible idea. And exactly the same is true with gene testing. So we're quite cautious about that. And I know different companies are trying to find gentle and positive ways to work with it. And I think some of the examples that have come through recently about direct-to-consumer gene testing has been quite disturbing.
Yeah, thank you for that. I agree with that. And what do you anticipate is going to happen? I mean, it seems like a fairly unregulated area at the moment, in the UK at least. Do you see that, do you think that that's going to be tightened up, in a positive way?
I do, yeah. It's going to take normally it takes a couple of disasters in the public eye, and then the regulations come in, and it becomes very much tightened up. And the UK is very good at that. The feedback from the consumer to the government sources, and then the government then speaking back to the people and saying, well, this isn't good enough. And I've seen that time and time again from the time that I was a GP in the UK.
Yeah, and so the prediction is that at least what will happen is that such testing will need to be managed via a practitioner, via a medical practitioner, a nutritional practitioner, or, somebody with the right professional background, training, support to be able to interpret and make sense of it. Yeah.
Yeah, we certainly hope so. And I think, have you spoken about examples? I can give a couple, which have been disturbing.
Yeah, please do.
So, there's been examples, I think, over in the States where someone gets a gene test back to say they've got a high risk for cancer. And then they think they're going to get cancer. That's just such nonsense. All that it means is that one of their pathways is moving down the wrong direction, and that their risk is slightly higher in that particular pathway than someone else's. But they could have a second pathway that's going down the right direction. So it really doesn't mean anything at all. And people can sort of live and die by this. There's someone I know who was told that with gene testing that she wasn't going to be a particularly good gymnast. She was a very talented gymnast, and it was all because her muscle type, it wasn't fast enough to slow twitch. And again, that's nonsense. And so people can be sort of quite affected in the wrong direction unless their hand is held through the whole thing. We don't do a blood test for someone and their sugar's raised and say you've got diabetes.
No.
So it's exactly the same for gene testing.
It is.
So the same rule.
And I think, taking your first point, that it's still very early days, the different combinations of genes that are tested, upon which then assumptions or predictions are then made. More and more information is being elucidated on the validity of using those sort of different gene combinations. So it's early days. So, I can understand people's interest, and, I think, there's huge public interest, really, from certain quarters of people, thinking, well, that information's available. I want to know what my, predispositions are here, there and everywhere. My other question is, what do you think about getting information about genetic, predictions in areas where it would appear there's nothing much that can then be done, where there's very limited intervention. Therefore, what would somebody be able to do positively to influence that? I don't know if there are examples of those kind of that sort of testing.
Well, there would be. So I think Angelina Jolie and what we call a high penetrance gene test, so the BRCA1 and BRCA2 gene test, which is pretty specific and leaves someone who's positive with it with a 95% chance of getting breast cancer or ovarian cancer. And in those circumstances, one needs to counsel beforehand as to, if we do this test, what does it mean? What are we going to do about it afterwards? And in her case, she knew that, she was going to have her breast removed and now her ovaries removed. And that's a very specific test. But most of our tests aren't what we call these high penetrance, these very, very specific gene tests. Most of our tests are low penetrance. So they have a low clinical reliability. So you'll have one gene that will be moving in one direction, but there could be another 3 genes moving in a positive direction.
Yeah.
And so overall, what do you see? So an example would be fat.
Yes.
So there might be one gene saying that if you eat fat, you'll become fat.
Right.
Then you might have another 3 genes saying that if you eat fat, actually it's quite good for you. And you should be eating more fat. And hence, that's part of the debate currently about what should we be cutting out of our diet. Should we be cutting out sugar as our biggest toxin, or should we be cutting out fat as our biggest toxin in our fight against weight, in our fight against heart attacks, against diabetes?
Okay. So what would you say are the more useful kind of genetic tests and information that's available? So, particularly as a nutritional therapist, I'm really interested in, where we can get maximum benefit for interventions, where compliance, I can see a case for it being really helpful for compliance against, following certain eating plans, etc. But are there is there particular genetic information that can really help us to determine those kind of lifestyle interventions and what's best for individuals?
Yeah, well, and I think that every 6 months we get more and more studies which are bigger and more robust, showing that we have more and more reliable information. And probably one of the most reliable is it's to do with things like vitamins. And I think we probably have, in the last 20, 30 years, as a society, started to take too many vitamins. It's been a sort of a hit and hope that if we take a lot of antioxidants, then something good might happen.
Yes.
And really it's been shown that's probably not the case. And so gene testing is one of the modalities we have to help us with that. So, for example, something like folate. So we all, well, not we as in men, but women will all take sort of folate when they're pregnant.
Yes.
And it's assumed that folate is good for pregnancy. It turns out with gene testing that numerous people, so 20 or 30% of the population, don't do well with the normal folate and actually have to take active folate, or folate that you get in food, like broccoli, or what would be called chemically methyl tetrahydrofolate. And so that's, I think, quite a good example of where gene testing specifically assists. And those people, if they took a multivitamin with folate, would still feel a bit tired, a bit sluggish. And if they changed often to the methyl tetrahydrofolate, the active folate in foods, their energy levels start to perk up.
Very interesting. You're familiar with the work of Ben Lynch in the US? I don't know if you are, but I saw a lecture of his on Saturday where he was describing the real detailed pathways of MTHFR and all the methylation pathways. So very interesting area in this exact context. It's
very interesting, and it's quite complicated, and there's still a way to go with it. And Ben Lynch does do some good talks on that. I don't know him personally, and I've seen a bit of his work, but it's a very important topic.
So what can be determined in this approach with regard to fat versus sugar, in terms of what people's individual predispositions are, is it possible to determine which is the lesser of the two evils for an individual? Can genetic testing show that?
It's starting to. Currently everything is up in the air as regards sugar and fat. We know that we had a blind spot to sugar over the last 30 years. And we know that being more aware of it and counting sugar, glucose, and carbohydrate levels is becoming much more common about town. And so we know that sugar is not good for us and it's worse than we thought. And now, if we take sugar out the diet, what do we put back in? And so the thought is, well, you can't put too much protein in. There's only one more option, that's fat.
Yes.
So if we put fat into the diet, does that leave us susceptible to heart attacks? And does it leave us susceptible to putting on weight? So the answer is currently that genetic testing will probably prove to have a very big part to play in this. And we find within our clinic and within the studies that we've started to do that we're starting to get directives from gene testing.
Very interesting. So, putting it into context, how might you use genetic testing in your practice? In a typical sort of, some scenarios.
So, a typical situation will be someone who's coming in and they've said, I've done a certain weight loss plan and it hasn't worked. I've done another one and it hasn't worked, and I'm still overweight and I don't know what to do. Okay. And then what we would do is we would do different gene tests, and we tend to combine them with questionnaires. So we tend not to do a gene test on its own. As a doctor, you don't just, if someone comes in, you go, no, wait, don't tell me anything, I'll just do a blood test. The clinical history, it's quite important. So I think it's important to do questionnaires with gene tests, to mix it, as we've always done, with the lab work and also, what the person's saying to you in front of you. And so combine that. And then there's numerous ways that one can see why someone might be putting on weight. It might be contributing from multiple things: poor sleep, an addictive tendency or liking sugars, which means that the brain happy hormones aren't as happy as they should be. It could be sugar overabsorption, fat overabsorption, the liver, or stress and something called cortisol. So there's numerous things that we could look at, and gene testing is quite an easy way to look at that as a good screening test.
Okay, so the result of that then can give you some pointers about the best way forward for that individual client that wants to lose weight on a sustainable basis.
Absolutely. And it's important in that if anyone gets gene testing back from a company, that it's the positives that you look at. You can't tell really about the negatives, but you can tell that someone might have a good ability to release fat during exercise, or they could have something that could be helped to release fat during exercise. Or that they are currently doing quite well with the sugar that they're eating. Or they're doing quite well with the fat they're eating. So there's positives more than negatives. You are going to get cancer. You have a weak liver pathway. That's usually the best way to express it.
And so, in your own practice, you're not actively using it in terms of identifying, risk of Alzheimer's, for instance, or other diseases. It's the Alzheimer's one that I think people perhaps are often most concerned about, because we have information that we know that there are some genetic links going on there.
There are, and that's the ApoE gene test. It is the most famous one, so the E4 and then the E3 and then another one with that. And I think it's terrible. My wife is ApoE3, E4 positive, and she has not got. And so if she just got that as an answer, she goes, "Goodness, I'm going to get Alzheimer's." And it's not true. There's no Alzheimer's in the family. And really, we're redefining what we know about the brain. The plasticity of the brain, the inflammatory model of illness in the brain is because of inflammation in the brain. That's very much in the last 10 years come forward. So just to say that one gene test will cause it, I think that someone with the gene test positive for it, if they led a reckless life, would probably get Alzheimer's a bit earlier than the average person.
Yes.
So they're at a higher risk of it, but it certainly doesn't mean that someone's going to get it. There's so many multi factors that play into it.
Mm. But it might be helpful for someone to be motivated to, live a healthier lifestyle, because I've heard, information saying, it can be really helpful for compliance, for people to, follow through with their healthy choices. Mm.
Yeah. And another good example is something called glutathione. So we do glutathione gene tests. And if we are, now that's one of the two big liver detox pathways, is the glutathione pathway. It's also one of the main cleansers of the brain, so very important in Alzheimer's. And it's also very important in the skin, so to help to keep skin cancers away. And we know that skin cancer has doubled and doubled again over the last 40 years, and we're all using sunblock, and the question is why. And a lot of it's to do with antioxidants in the skin. So the thought is that if you are glutathione, or the natural antioxidant deficient in the skin, then you probably need to put a bit more work of putting antioxidants into the mouth and through the skin. And that will probably benefit the skin and support it where your glutathione is failing. Mm. So if that makes sense.
So you can identify through the genetic testing whether your glutathione pathway is kind of optimized, or whether in fact it's compromised through your particular genetic expression.
Exactly right, yeah. And so if it's compromised, there's stuff you can do about it. So you would say, I'm deficient in glutathione, it's an antioxidant, therefore I will take other antioxidants to support that system. Yeah.
Very good. So where do you see the future going in terms of this area? It's early days, but if you were to sort of run the clock forward a little bit, I don't know how many years it would be, but where do you think we'll get to with this kind of genetic testing?
And I think we're going to get to genetic testing being one of a few tests that, as a GP, as a nutritionist, that we're able to perform, and it will give us information. Rather like you don't do a mammogram on a breast and write, there's a shadow and therefore there's a problem. It means one does another test. We'll do gene testing, and we suspect on a very easy, because a gene test is just a saliva sample, it's not taking blood, it's nothing invasive, and we'll suspect there's a problem in a certain direction, and that'll allow us to look a bit deeper. So I think that certainly with weight loss nutrition, we'll get more relevance as to which of us can actually eat more of the fats, more of the saturated fats, and probably quite a few of us can. And who of us, although we're not diabetic, should be careful of sugar, because it's within us, probably causing more damage than we realize, and more damage than our blood test can currently mark.
Yeah. So it's giving you another level and another layer of information to take into context with the other clinical markers that you'd be monitoring anyway, whether it's blood sugar or blood pressure or other conventional markers. Yeah. So, yeah.
And I think it's going to grow the side of wellness. So we've been dealing with illness for the last 50 years, where we've become very good at treating a heart attack, very good at treating illness, treating infections. But very much people are looking more and more, with the advent of internet and knowledge, to what can I do to optimize my wellness.
Yes, I think that's really nice. So it's really going to help the sort of preventative side of the equation, rather than waiting till there's a problem. Yeah, and help steer people in the right direction, in areas that they can do more in to help wellness and prevent disease long term. Yeah, I like that. Good. Okay, thank you very much, Duncan. It's really a pleasure to have you with us on the show. I'll let you get back on to your busy day, and I hope the sun's shining in Cape Town for you today. It certainly is here in Marlow. It's a lovely sunny day, and I think we're on track for the hottest day of the year tomorrow, and you're just going into your autumn, I guess, aren't you?
Well, Anne, Sheila, thank you so much for having me on the program. When I was in the UK just over a week ago at Easter, it was quite cold. We were in Legoland, it was freezing. So I'm very glad it's warmed up, and yes, it is starting to cool down here.
Yeah, good. Okay, thank you very much. It's been a pleasure.
Okay, thank you. Thanks. Bye.